Welcome to Gamechangers, the series where we are speaking with a wide range of players in healthcare: nurses, physicians, healthcare policy makers, industry, to talk to them about how data can be the transformative force of healthcare. And today I'm really fortunate that I'm going to be speaking with Paul de Rave, Secretary General of the European Federation of Nurses. Paul, we have an amazing new piece of legislation on the horizon, the European Health Data Space. It's all about making data more usable, both for primary care and for research. Do you think the European Health Data Space can change the way in which nurses provide care to patients in every day, both in the hospital and in the community?
I think it will, very, very clearly, because nurses need data at their fingertip. In order to be a good nurse and to deliver better outcomes, you need data on your fingertips and receiving data, but nurses are also there to put into the electronic health record the data that other care professions and the patients needs to run their own management of their healthcare status. So in that sense, it will be very important, in line with existing legislation that we have already on privacy, because the informed consent is something that is precious to nurses, and we use it in our daily practice every day to inform the patients what is going to happen to them and how can the data help us in this informed consent. So I think that it will be a huge opportunity for the frontline nurses to use the EHDS, to use electronic health records, and most important, interoperability. If we have better interoperability, we can do our job better. We don't have to wait for anybody else. We can do with the data we have at our fingertips.
Thank you very much. Now, you mentioned there that nurses need data in every part of their functioning. But nurses haven't necessarily learned digital skills in their training, and perhaps more importantly, their patients might not have the digital skills and the digital literacy. Do you think digital literacy is a barrier to achieving change in healthcare?
It's not a barrier, I think. It's not a barrier, it's just an opportunity, I think, because with the developments of the European Commission, DG Grow, DG Employment, DG Santé on the Skills Pact, I think the Commission realized that upskilling digital skills for the health workforce is a key issue. Now, nurses and physicians and pharmacists for the last 15, 20 years are using platforms in their day, are using digitalization. So there is nothing new, but we could go a step further. And that is the challenge. That is why we want to upskill the young generation of nurses or nursing students to bring them into contact with the IT platforms, with the access to these platforms, and also the electronic health record. Not only to put in the robust data, but also to use the data for nursing research, for evidence-based practice. These are key opportunities for nurses.
So the EHDS is just one of the new legislative proposals. You've mentioned a few others, but if you had one wish that you could give to the co-legislators, the European Commission with all its departments, the Parliament and the Council, one wish to use the power of data to transform healthcare, what would it be, and what would it be on top of the European Health Data Space?
I think on top of that is always money. That's how simple life is. If member states, healthcare systems are cracking down, it's because they don't have the facilities, it's because they don't have the workforce. There is something lacking nowadays in those systems. So in that sense, digitalization needs to be supported through the European recovery and the resilience plans. And there is already a regulation in place that member states need to use 20% of that billions that they got into the digitalization, but we need to scope down how they can support the frontline people, how they can support the nurses in using these tools, because if your team has shrunk down from 45 to 10 nurses, I mean, even if you have the best digital skills, you need the nursing workforce in order to do that. And I think that the European recovery and resilience plans and the European semester need to look at these things, the workforce planning, how much nurses do I need per patient in the community, in the hospitals, and how can digitalization be used to lead to better outcomes. So the OECD, the Commission, WHO, Copenhagen should work closer together to get things done. And I think that is the key message.
Thank you so much for sharing your thoughts. We stand with you, and we really hope that data can change the lives of nurses who change the lives of patients every day.
Thank you very much. Thank you.